Dr. Sushovan Baidya, a hepatologist from New Delhi, as our guest speaker. Sir is one of the leading hepatologists and gastroenterologists with over 10 years of experience and specializes in gastroscopy, endoscopy, colonoscopy, and management of post liver transplant. Sir is actively involved in various research programs and author of several articles on both national and international level. He is currently working as consultant at Department of Gastroenterology and Hepatology in St. Stephen's Hospital, New Delhi. We are grateful for his dedication to improving liver health and educating others about this important topic. Without further ado, I would like to invite Dr. Sushovan to share his valuable insights on management of MASLD or MASH. Over to you, sir.
Thank you. So, good morning, everyone. So, the orientation of this talk will be to raise awareness among common people. So, I am privileged to talk on this topic, which is a very important and a common problem now that we face every day. So, when we talk about liver is the second largest organ of our body, and it's a very highly vascular organ. But I would request you not to look at the liver like an organ, like that is in the left. So I think you look at the picture that is there in the right, which shows multiple computer screens with the seat there. So this is actually a control room. So you can call liver to be the control room of the body's metabolism. So this is what liver does. So if we come to the functions of liver, so you see, like there are multiple functions: destroys RBCs, process nutrients, produces bile. But to among all these functions, the most important will be to process nutrients because all the nutrients from what we eat comes to liver after absorption, and then it controls all the metabolic processes of the body. So, whether it be glucose metabolism, whether it be protein metabolism, whether it be lipid metabolism, everything is happening in the liver. So, you can call it to be the chartered accountant of our body. So, like a chartered accountant is a tax filing time now. So, we remember our CAs. So, we go to our CA, and the CA has record of all our incomes. And so, similarly, liver does the same thing. Liver keeps a track of all our body's metabolism. It what we deposit, what our expenditures, and regulates all of them. When we talk about MASLD. MASLD is the new terminology for fatty liver disease. Earlier it was NAFLD. Now it is called MASLD. So the full form is metabolic associated steatotic liver disease. So when the fat content in the liver is more than 5%, we call it as MASL. Generally, it is 1 to 5%, but when it increases more than that, it is harmful, and we call it as a disease, that is steatotic liver disease. This MASL is very predominantly, is highly prevalent in the general population. So if we see the general population, 1 out of the 4 people has MASL. But when we take this population to be diabetics, around 6 out of 10 will have MASL. And in obese, almost all of them will have MASL. So I will highlight this line here. All those who have MASL today will have type 2 diabetes tomorrow. So on this I'll come in the later slide. So steatotic liver disease is not a single disease. It is a spectrum. So when there is when deposition of fat in the liver, it causes fatty liver. Gradually, this fat causes inflammation, which is known as steatohepatitis, and inflammation is healed by fibrosis. So liver fibrosis develops, and gradually this liver fibrosis becomes permanent and causes cirrhosis. But once cirrhosis are developed or in the state of liver fibrosis, there is always a high risk of hepatocellular carcinoma. So although this is not in the progression spectrum of the disease, but I would like to mention it here because this is a very, very important and life-threatening complication of fatty liver disease. So when we talk about the causes of fatty liver or the risk factors of fatty liver, the most important are these. This is obesity, when you have a genetic predisposition for fatty liver, and when the food intake is not right. Food intake is not right means when you are consuming alcohol, when you are taking red meat, when you are taking saturated fat like ghee, butter, dalda, junk foods. like pizza, burger, samosas, all these things. And uh, the other most important factor, which multiplies these problems, is physical inactivity. So when all along all this genetic background, bad food intake, obesity, physical inactivity gets in addition, the rapidity of development of fatty liver disease increases many times. So does fatty liver disease occur in children? Yeah, this is a very common problem now. Fatty liver disease does occur in children. So this is a very common scenario we face daily. A child who is just of 10 years, 11 years comes to us with fatty liver disease. So this is a vicious cycle. This fatty liver disease goes in hand with childhood obesity. So as you can see in the right, when a healthy child becomes more and more sedentary uh, because of lack of parental guidance, he plays video games, has high fatty foods, no physical activity at all, no games, no outdoor games. He gradually develops obese. When he develops obese, he decreases his movements, his mobility, and he becomes more lazy. And he gains on weight, and this vicious cycle goes on. And as he becomes gains more weight, the other complications of obesity develop. So this fatty liver disease goes hand in hand with this cycle. So the problem statement, the problem of a childhood fatty liver will be that when there is a fatty liver very early of age, so this fatty liver goes on for a long time, so cause a long time damage in the liver, and the complications of that fatty liver comes very early. So we need to the parents need to be careful about this. They must intervene as early as possible into this vicious cycle of childhood obesity and fatty liver. I'm giving a significant amount of time in this slide so that we can understand the impact this childhood obesity has on our society. So fatty liver is and diabetes. This they are best friends, you can say. So diabetes increases fatty liver, the risk due to fatty liver, and fatty liver, when there is deposition of fat in the liver, it causes insulin resistance, which is a well-known fact. And when there is insulin resistance, gradually in the future, in near future, I would say, not in a long-term future, in the near future, it develops type 2 diabetes mellitus. So again, I would highlight this same line. All those who have fatty liver today will have type 2 diabetes mellitus in the future. So how do you know you have fatty liver disease? So fatty liver disease has some common symptoms. The most important symptoms or the most common symptoms would be fatigue. So other than fatigue, you can have slight heaviness in the right upper part of your abdomen, or you can feel slight pain. A very specific factor for insulin resistance, which comes with fatty liver, is acanthosis nigricans. You can find that the skin around your neck or your armpits are gradually getting darkened. So most of the time, we feel that the general population feels that it is dirt, and they try to wash it off, but it is actually not. It's acanthosis nigricans. So when this kind of sign appears, please visit your doctor, because this might be a sign of insulin resistance. And you might be developing type 2 diabetes, and you might have fatty liver disease underlying, which needs to be checked up and treated. So how do we diagnose fatty liver? So most of the time, ultrasound gets done, since we all know that fatty liver disease is a silent disease. It doesn't cause that significant of a symptom. It doesn't cause severe pain. It doesn't cause severe weight loss that for which a patient runs to a doctor. So it's silently lurking behind the shadows in your body. So most of the time, you will get ultrasound done for some other disease, and it gets incidentally picked up. And then when you see there is fatty liver disease, you visit a doctor. So are there other ways of knowing you have fatty liver disease? Yes, there are both invasive and non-invasive methods. So I will come to them one by one. So we do different blood tests. We do ultrasound, fibroscan, and liver biopsy, and there are other methods of MRI and CT. So if we come to them one by one, the first would be blood test. So blood test, we look for liver enzymes. Liver enzymes are mainly SGPT, SGOT. The other names of them are ALT and AST. So when in fatty liver disease, we find a slight increase of ALT. It might range from maybe 0.5 times to 2 to 3 times. And most of the time, this ALT will be more than AST for fatty liver disease. So, but you have to understand that it doesn't mean that your ALT is not raised or your liver enzymes are not raised. That means you are immune from fatty liver. So, fatty liver can either present as a raised ALT or it can be normal. And the other thing you must know that the level of ALT rise does not always correlate with the severity of this disease. Many a times you may have a very low elevation of ALT. Maybe the normal ALT value is 35. You might be having 50. Just maybe 0.75 times rise from your upper limit of normal. But the damage may be significant in the liver. There is no way of knowing from blood test how much your liver is damaged. So to come around this problem of non-correlation, we have developed multiple scores like FIP4, NFS, NFLD score, APRI score. All these things are indirect scores where we take out multiple blood tests, where you do multiple blood tests, find out the values and add them up to find a score and try to predict how much of fibrosis you have developed in your liver due to fatty liver. So there are other non-invasive techniques. Most of the time it is ultrasound. In ultrasound, we can grade fatty liver. Is it how severe it is, like grade 1, grade 2, grade 3, depending on the radiological findings. But often it is not specific. And it only detects if your fatty liver has increased more than 25%. So until it has progressed very far, you won't find on ultrasound. And again, the severity does not correlate with the grade of fatty liver in ultrasound. So what to do for that? We use fibroscan, a technique called fibroscan. This is a machine-like ultrasound where a technician keeps the probe on the right hypochondrium or right upper part of your abdomen, and this uses a technique known as transient elastography, where this particular machine of fibroscan, it generates sound waves. That sound waves travels through the liver and then comes back into the probe again. And the transducer records these sound waves and gives a value of how much of fat is there in your liver, and due to that fat, how much of stiffness has occurred in your liver. So this is a very modern and scientific technique, and also non-invasive. It does not cause pain. It does not need to. We don't need to cut anything. We didn't need to prick you for this, but this gives a very good value, and we can go on with it. We can see the intensity of fatty liver you have, and we can prognosticate you accordingly, and we can treat you accordingly. So the very specific non-invasive technique nowadays is use of MRI, which is known as MRI PDFF. But this is very costly and is not available in most of the centers. So currently, this is not used in day-to-day clinical practice. It is only used in research setting. So this might not help you practically because it is most of the time not available. But if it is available at your center, then this is the best test to do, sort of liver biopsy. So why I'm telling that? Because liver biopsy, a piece of liver, a piece from your liver might be the gold standard test to see how much of fatty liver you have developed and how much of fibrosis is there due to this fatty liver. But you must understand that liver biopsy is not routinely done for fatty liver disease. Most of the time when we as doctors have a dilemma, do you have fatty liver disease or this present liver disease is due to some other disease, liver biopsy comes into play, where it acts as a tiebreaker to differentiate fatty liver disease from other diseases of the liver. So once fatty liver develops, they say that around 30% of them goes into steatohepatitis, and then they develop fibrosis, and at last 15% of them develop into cirrhosis. But and this out of this 15% who have developed cirrhosis, around 5 to 10% of them develop liver cancer. But that is not what I would like to highlight you here. So this red circle shows that 20% of them are rapid progressors. So once you have fatty liver, you can either progress in some time, maybe 7 to 10 years, or you can progress faster. So this rapidity of progression into higher grades of liver disease, of developing cirrhosis or developing cancer, does not really depend on you. It depends on your genetic makeup. There are multiple genetic polymorphisms which scientists have identified that could lead to rapid progression of your disease. So once you develop fatty liver, please go to a doctor and please get it sorted out, because you never know that you lie in this 80%, those who progress slowly, or you lie in this 20% which will progress fast, and you will very fast land up into in a irreversible condition from where there is no point of return. So does fatty liver affect liver alone? The answer is no. As there is fat deposition in the liver, there is also fat deposition in your arterioles or your blood vessels. That is known as atherosclerosis. So once that develops, it causes a high morbidity for cardiovascular disease. It causes hypertension, it causes heart attack, it causes stroke. So never neglect it. Fatty liver disease does not affect liver only, it also affects heart, it also affects brain. And nevertheless to say, it can develop liver cancer. So liver cancer always doesn't develop when there is cirrhosis. So even when the cirrhosis has not been formed, there is an early stage of fibrosis. Liver cancer can develop in fatty liver disease. So how to manage you, how to treat a patient for fatty liver disease. So the most important interventions will be dietary, exercise that comes into these lifestyle modifications. And of course, there are new medicines. I will come to them one by one. So the goal of your diet and exercise would be to lose weight. So they always say that to lose weight, the best way is both diet and exercise. So as per guidelines, you must have a moderate intensity workout at least 30 to 45 minutes per day, daily. So if you can lose weight by both of your diet and exercise, the 3 to 5% weight loss can help in your fatty liver state, in your steatosis, fat content of your liver. And if you can lose more weight, that is 7 to 10%, it can even cure inflammation in your liver and also delay fibrosis. So as it is shown here, that weight loss affects fatty liver. So if you decrease 5% of your present body weight, you can decrease fat content of your liver. And if you decrease more than 7%, then inflammation in your liver comes down. And if you can decrease your weight more than 10% of the present weight, then even the fibrosis that has developed in your liver comes down. So what to eat? So this is a very important and very common question we come across. So the principle of food in fatty liver would be to avoid saturated fats. Saturated fats like ghee, butter, dalda, red meat, junk foods, highly sugarated drinks like cold drinks, smoothies, fruit juice, real fruit juice, all these things. This cause a high amount of sugar surge in your body. This they deposits as fat. So what to eat to avoid them, and what to eat mainly you must have a high consumption of low fat proteins like fish, seafood, and fruits, adequate amount of fruits and vegetables. So I have got a website of my own, that is www.broadgutexperts.com. If you visit this website, you will find multiple PDF sources of what to eat in different liver diseases. Recently, I have added the fatty liver diet chart as well. So please visit this website. You can get more information there. So exercise, when we talk about exercise, there are mainly two types of exercises. One is aerobic exercises, or the other name for this is cardio, and the other one is resistance exercises. So in aerobic exercises, this comprises of exercises like walking, jogging, running, swimming, cycling. All these things are aerobic exercises or cardio exercises. And when you talk about resistance exercises, this means when you deal with weight. So either it might be isometric exercises or you might be using weights to go on with this exercise. So in aerobic exercises, it reduces your weight and it reduces liver fat and also improves your cardiovascular conditioning. And when you do resistance or weight exercises, that that is an important action on your glucose insulin sensitivity. It decreases insulin resistance. It decreases the harmful effects of fatty liver. That is, it decreases the risk of type 2 diabetes. So when you are exercising, you have to do both aerobic exercises and both resistance exercises. So I think this whole slide is about how to relax your mind, meditate, meditations, yoga, and check your body and once in a while go for medical checkups. But I would always say to my patients that please relax your mind, but not your body. Keep on exercising, keep on moving, keep on decreasing weight. So the new medications that I was talking about. So the backbone of medical therapy for fatty liver lies on these drugs: pioglitazone, saroglitazar, and vitamin E. Saroglitazar, vitamin E, and pioglitazone we have been using for a long time. Saroglitazar has come for a in recent past, last few years, and it has been recommended by Indian National Association of Liver Disease, inasal. And this drug, this not only it has multiple beneficial actions. Saroglitazar decreases lipids, decreases some amount of weight, around 3 to 5 kgs of weight you can lose using saroglitazar, and also it helps with fatty liver disease. And there has also been reports where we find that there has been decrement of fibrosis due to saroglitazar. There are multiple new drugs that were in the pipeline and recently been approved. They are resmetirom, semaglutide, tirzepatide. All these drugs are new drugs, and I feel that they will change the future of management of fatty liver disease. So, as a whole, what to do to prevent fatty liver disease? So limit intake of saturated fats and trans fats. Eat a balanced diet where you have everything. You have carbohydrate, you have protein, you have low amount of fat. Limit consumptions of refined carbohydrates. Maintain a healthy weight. Quit smoking. Exercise regularly. Avoid alcohol, not limit alcohol. I would say avoid alcohol and take medications as prescribed by your doctor, obviously. But this is the fact I would like to highlight again. No amount of alcohol is good for health. There is a common myth. Everybody feels that small amount of alcohol is good for the heart, but it is not. Recently, American Heart Association in the 2025 update had clearly mentioned that not no amount of alcohol is good for heart. So please avoid alcohol, as no amount of alcohol is good for your health. So if there is one take-home message from this entire talk, what I was trying to say for last 10 minutes, that is food is medicine. Food is your medicine. Drugs come later, but food is your main medicine. So a healthy diet and the healthy lifestyle is the first step towards a healthy liver. So let's not be silent about this silent disease, and your liver could still be at risk when you don't drink alcohol. We understand this. We understand fatty liver, and we all together fight against fatty liver so that this common problem, common modern problem, has a cure, and we can do away with it. This I think more than medications, more than interventions, the most important thing is awareness. So once you know about this disease, you can tell your friends and family what to do, and we can tackle this disease altogether. Thank you.
Thank you, sir, for this wonderful talk. This has enlightened us now. And we have few questions on, from our audience. But before we move to it, so I would like to know, you mentioned that you have developed one website, I think Gut Exercise Health. Can
Growth
you
Gut
just,
Experts.
Go context.
www.growthgutexperts.
Right. So
Please
can
do
you
visit
just
that website.
elaborate what all things our audience can know from that website?
Yeah. So we have developed resources for our patients. So in those resources, there are videos that from the videos you will know about your different health related issues. So it not only contains regarding to liver and GI, it also has aspects of pediatric endocrinology. So you can get endocrine and GI and liver related informations from that. And we have incorporated resources about exercise. We have incorporated the resources about diet in that website. So once you visit, everything is very lucid. You can go through step by step, and in very less time, you can get all the information.
Thank you, sir. Now that would be great help for our all the audiences.
Yeah.
Uh, then I will take the question, sir. The first question I've got is like, is MASH or MASLD age specific, or it can happen to the people of any age?
Yeah, I think I had taken a significant amount of time in one of the slides. So it is not specific. So the growing problem presently in our society is pediatric fatty liver. So I get a lot of patients, those who are less than 18 years of age, or I would say that they belong to a age group of 10 to 12 years. So where they have developed fatty liver. So the problem with this age group is once you develop fatty liver at 10 years of age, and you are when you grow up to be 20, so already you have 10 years of fatty liver, and 10 years of fatty liver is enough to cause cirrhosis and to cause liver cancer and to cause other complications of fatty liver disease. So even pediatric fatty liver is a more dangerous than adult fatty liver, as there is a significant amount of time the liver fat is there in your liver. So we must tackle that in childhood itself.
Right, sir. Then we have another question, sir. You mentioned of exercise as one of the lifestyle modification of fatty liver. So question is like, we should we go for light exercises or strenuous exercises are needed?
So the recommendation is that you do 30 to 45 minutes of moderately intense exercise. So what does that mean? Moderately strenuous exercises. So moderate strenuous exercises means when you are trying to do some exercise, you should have difficulty in saying your name. So you should not be easily be able to say your name. That is amounting to moderate listening exercises. But I would not recommend that. Don't stick to 30 to 45 minutes. You move whenever possible. When you are talking over phone, when you are going, when you are when you have the option of lift and stairs, use the stairs. When you have option of auto or means your car and walking, walk. So always keep your body moving. Other than this fixed amount of exercise, always keep your body moving. I hope the answer is clear.
Very well explained, sir. Thank you. And then another question is, sir, is there any difference between the diet between the alcoholic fatty liver disease and non-alcoholic fatty liver disease, or diet recommendations are almost same for both?
So, uh, first of all, in alcoholic fatty liver disease, I think that is the previously this differentiation was there. Previously, in our research bodies, these two terminologies were there: alcoholic fatty liver disease and non-alcoholic fatty disease, ALD and NFLD. But this terminologies has been done with. So now this terminology doesn't exist. So this because it is a stigmatization against alcohol. So these patients do not drink, those who do not drink alcohol, you are attaching the name of alcohol to those fatty liver disease as well. So what I'm trying to say is that first of all, no amount of alcohol is good for liver. But when you develop fatty liver, means this diet is not separate for both alcoholic liver disease or fatty liver disease, because you may have both. So presently, in the definition of metabolic associated steatotic liver disease in MASL, they have also incorporated a small amount of alcohol intake. So if the definition doesn't change, if you drink alcohol to that extent, the definition doesn't change. Only the definition changes when the amount is higher. So the diet is not different. Diet is same for both. because you may have both. Once you're drinking alcohol, you may have metabolic problems. So both goes hand in hand.
Right, sir. Thank you. And one last question we have is fatty liver reversible, or once we are caught into it, it stays lifelong?
So, fatty liver is reversible. That is the point of this awareness. That is what we are striving hard. Hepatologists and gastroenterologists, or all the physicians, endocrinologists, everybody is striving hard because this is a common problem and it can be reversed, but only to a certain stage. When this fatty liver disease progresses, gradually develops fibrosis, and fibrosis means where the liver inside gets shrunken. So when the liver gets shrunken, once it gets shrunken, it cannot be reversed. So once there is fibrosis, higher grades of fibrosis, or there is cirrhosis, permanent damage, it cannot be reversed. But when there is only steatosis and the early fibrosis, it can be reversed. Both the most important would be by lifestyle modifications, exercise and dietary changes, weight loss, and with new drugs. So it is reversible in the early part, not in the later part.
So, key to success is we should address it at the early stage itself, right?
Correct. And food is medicine. I am saying repeatedly, food is medicine. That is the only medicine and the most effective medicine for fatty liver disease.
Thank you, sir. That was very well informative. And on behalf of Nash 24 by 7, I extend my sincere thanks to Dr. Sushovan for his enlightening and engaging talk on MASLD. Sir, insights have highlighted the critical need for increasing awareness about fatty liver diseases and related conditions. I also want to express my appreciation to the audience for their active participation and raising few of the queries that was beneficial, whose answers were beneficial for everyone and their valuable contributions. Your feedback and suggestions are essential as we strive to enhance our future Facebook Live programs and educational initiatives. Please stay connected with Nash 24 by 7 on Facebook for updates and information on upcoming events. And remember, your health and the health of your loved ones is of paramount importance. So take care and stay well. And once again, thank you, sir. Thanks for attending this session.
Yeah, thank you. Thank you all.